WOWO 1190 and 100.9 FM and podcasts by Federated Media present Ragz in a Box. Mike Ragz goes one-on-one with local business owners, dignitaries, and celebrities to discuss their impact in our community and how they affect the lives of Fort Wayne citizens. Here's Ragz.
Well, this is my inaugural guest on my brand new podcast, and we welcome him in. Local chiropractor is going to stop by. He wrote a book, and probably one of many he's going to tell me about that he's written. Dr. Richard Busch from Busch Chiropractic. Can I call you Doc? I mean, it's
Yes.
the easiest thing for me. How are you?
I'm great. And yourself?
Not too bad. Thanks for joining us here for this inaugural podcast. And, of course, Riviera Drive is where we want people to go, right?
Exactly.
Busch Chiropractic.
Actually, Ragz, first of all, I feel honored to be the first guest on
listen,
your
you know
initial
what?
podcast here.
When I hit you up for a back straightening later on at the end of this, so just remember that. The book is called Surgery Not Included, and obviously you're looking for ways for people to get their backs better without having to go under the knife.
Exactly.
And that's what you specialize in. Before we get into the book here, first off, let's get your background so people know what you're all about. Born and raised in
Fort Wayne.
Nice to hear. And where did we start our practice? Where did we start learning about our practice?
Well, actually, okay, just to give you a little bit more background, I'm from Leo.
Okay.
Did my undergrad at IU. I did some of it here, some of it in Bloomington.
All right.
Went to Parker College of Chiropractic in Dallas, Texas. Every winter, every February, I wonder why the heck I came back here. Don't get me wrong, it's a fantastic place. I love this place, fantastic city, great place to raise a family, but the weather sucks in the winter.
Yeah.
Other than that, no, I opened my practice in 1996, where it is now on Riviera Drive. It's right behind the Partners First Credit Union back there.
Right.
Okay, so if you know where the Fish House is and Baker Street on the other side of Clinton Street, we're back in the Northcrest Addition. We started from scratch there in 1996, and I did the unthinkable thing of getting married the month after I started my practice.
Wow,
or the month
that's
that
bold.
I guess the month before I started my practice. That was crazy. I would not recommend that for anybody. Still married to the same wonderful woman.
I was going to ask how it worked out.
Still married to the same wonderful woman. We've got two daughters. They're in their 20s, 20 and 23, and then I've got a surprise. His name is Richard the Fourth.
Oh, look at that.
I wasn't gonna name him the fourth, but I have to tell you what, my wife told me I wasn't getting another shot at it, so I thought, you know what? And she said, I don't want to hear you complain about it in a couple years. And
being Richard the Third, I mean, that's a big big title to hand down. So, why this? Why did you go down this road? Was there someone in your life that you saw struggle with back pain and that kind of pain, and you said, you know what, I want to be able to fix this?
Actually, this is the more interesting part of the story. My family has been in chiropractic for literally the last 50 years. My father practiced in Fort Wayne in the early 80s, late 70s, early 80s, or early 70s, and into the 1982. Is when he retired from practice.
Right.
My family still publishes the American Chiropractor Magazine, which is a national chiropractic magazine. It goes out to 50,000 chiropractors on a monthly basis. I've been involved in that. Actually, I'm still, I guess, a special assistant to the publisher at this point. I do consult with the magazine on some of the things that they're doing. In fact, I had done a lot more as far as editorial. I'd been president of the magazine for several years as well. And one of the things that I started to notice is that, there are a lot of things that I can do from a chiropractic standpoint to help patients avoid pain. Okay.
Right.
We help with neck pain, headaches, all of that stuff, some minor back issues. The problem is there's a whole bunch of people who are dealing with really severe chronic back pain, neck pain, sciatic pain. You probably have heard of that. That's the pain that radiates down the legs.
Yeah.
We got pain that radiates in the arms in the arms as well. Numbness or tingling in the arms and the hands. All of these things are associated with what's happening in their spine. And
Wow.
and the problem is there's a limit to what we can do from a chiropractic standpoint in some cases. And what we start to see is that those patients' options get very small very quickly. Okay, so if I can't help them from a chiropractic standpoint, then first thing I have to do is send them off to probably a pain management doctor. So they're going to get meds, probably injections, and then they're gonna have to go from there.
Sure.
And then their next option is surgery. And we all know somebody who's had a problem with surgery. And the thing I want to make sure that you understand is I have a great relationship with the surgeons in this area and the medical community as a whole.
You will recommend it if needed. It's not like, right.
Oh, yeah, certainly. And so they all do a great job with what they do. I just want to help them do a little bit less. And so the thing about this is, especially with the opiate crisis that we're experiencing now, I don't know if you realize this, but how many people died in the Vietnam War? About 70,000, right?
Yeah,
okay.
yeah.
You know how many people are dying every year as a result of opiate overdose? More people than die in the Vietnam War, okay? That's every single year at this point. And so we're talking about a lot of people who have had a lot of problems with these medications. And so when you start thinking about that and you start thinking about how big that problem is and people dealing with chronic pain, and their only options are either medications or to live with it.
Yeah. Well, I wanted to talk about that too, the live with it part, because it seems to me, even it's my own personal experience too, Doc, is that people will tolerate back and neck pain more than any other pain in their body. You know, if something's wrong with their head, obviously headaches, but for some reason they're like, well, I'm just getting older. I got to deal with it. And I'm sure you come across with that a lot. So at what point do you take, do you, any amount of pain, go see someone like you? Or at what point do we say, you know what, there's something wrong. It's not just a tolerance level.
I think probably the easiest way to look at this is from a quality of life standpoint. Is it affecting what you do?
Right.
Is it affecting how you interact with the people around you? Is it affecting how you interact with your family? Okay, when we start to see these things limit our lives, I'm of the mindset that if we can do things properly, we can help people avoid pain, help them avoid chronic problems, and help them avoid a lot of the limiting factors in their life. And so if there's something that we can do to help them avoid that stuff, that's one of the reasons I've dedicated my life to helping people avoid not only needless and unnecessary surgeries, but also needless and unnecessary medications, because the medications all have side effects that are actually worse than what they're taking them for.
Yeah.
And so when it comes down to that, if there's an option that we have where we can avoid having them have to go to the surgeons and have to do some of those other treatments, that, once you have surgery, you can't have it undone. So, if we can actually help them avoid that stuff later on, then I think it's a very beneficial thing to do.
The name of the book is called Surgery Not Included. We're talking with Dr. Richard Busch III. We've mentioned that. And it's almost like everybody has it, right? It seems like everybody's got some sort of back pain, whether they're getting up in the morning or they're sitting at their desk a long time. It doesn't matter what age you are. One of the chapters is called Back Pain is Universal. It is true. You talk to anybody, there's something wrong.
It's the number one cause for people to miss work.
Right.
Okay. It's the number one reason people, and along with that, it's also the number one reason people miss work over an extended period of time as well. Okay. And so it's something that you don't really think it's as big of a problem as it is until it actually affects you. And, I see a lot of patients, they're like, I've never had any problems before, but I can't walk now. What should I do?
Yeah, well, and it's all that whole song, the knee bone's connected to the such and such.
Right.
And it just seems like you might have a pain in your body that don't even, like you mentioned earlier, it's because of your spine and it's leading from your back.
Exactly.
So how often do you recommend, because I've gotten my back alignment, I've done all that. How often do you recommend someone to do that? And should you do that without any pain? Like if you're not feeling any problem, it's still okay to come in.
Well, do you get your oil changed in your car?
I do, yes.
Whether the oil light comes on or not?
Correct.
Okay. Same type of thing here. If you think about it from the standpoint of, from a wellness standpoint, if you think about the way that your body functions, if everything is communicating properly, then you're going to do really well, right?
Right.
Okay. If for some reason you have pressure on a nerve somewhere, you may not even notice pain. You may just notice that you just don't feel quite right. We see this in athletes a lot, where they come to the big game, but they just don't have it, right? There's something else going on there a lot of cases, or that feeling where things just aren't right. And then after a little bit of this, we start to see something called dis-ease. You probably have heard of disease. Okay, that's what everybody's over at the hospital for.
Right.
Dis-ease is just what the word says it is. It's a situation where your body's not at ease. These people, in a lot of cases, may be a little bit more irritable, have a little trouble relaxing or even sleeping. Okay, those are all signs that something's not right. And those are all signs before we start to see the real symptoms take place. So I see a lot of patients from a wellness standpoint where they're like, you know what, I just feel like things, could just aren't right, or I feel a little bit of crick in my neck, or I feel like I could do a little bit better. And then what happens is we can examine them and determine what their problem is. If they have any real problem, if they do, we can actually recommend a course of action based on that. But if they don't, in a lot of cases, we'll see patients just from a wellness standpoint.
Right.
You go to the gym, don't you?
Yeah, sure.
Okay.
Yeah.
Okay. When you go to the gym,
my back's killing me usually after everything. I'm just kidding. But no.
All right. That's a whole other story.
Well, I am 50 years old now. I will say the joint pain is just, it seems normal at that point in time. At that age, after you do a run or lift some weights, you're going to feel it.
Right. Well, and a lot of that has to do just with day-to-day activities where we start to see wear and tear develop over time. But at the same time, if you think about it, and this is kind of taking a little bit different turn here, but if you think about it from a standpoint of nutrition, whether it's proper hydration, whether you're drinking enough water.
Right.
Okay. From a supplementation standpoint, in a lot of cases, as we get older, the joints or the cartilage in the joints can dry out. And that's where cartilage or the degenerative changes can come in.
Right.
Now, where does that stuff come from? In a lot of cases, it comes from the rest of our diet. Okay. Things like whether it's anti-inflammatory medications that we're taking, which actually cause the cartilage to become a little bit more dry. It actually slows healing process. Along with that, some of the diet things that we can be looking at, like excessive caffeine intake.
Right.
That stuff actually causes a lot of the soft tissue to lose
Great.
some of the water.
So all that coffee I drink,
all the coffee is not good for you.
Now I know.
Don't get me wrong. Hey, I'm not a coffee Nazi here. Okay?
Right.
In fact, I like my coffee as well. But those are all things when we start to look at the big picture. And what happens in a lot of cases when we start to look at some of the things people are taking nutritionally or from in their regular diet, there are some times where we can actually start to clean up the diet, look at more fresh fruits and vegetables, and then lean protein, get away from the carbs and a lot of the things that actually cause other problems, and it'll actually cause those joints to start to become a little bit less stiff and rigid. There are also some other things that go along with, and I hate this the stuff where people are like, well, I'm gluten free now, but everybody's gluten free at some point in time or another, right? Well, the thing about that is it's because of some of the proteins that are actually in the gluten and that type of thing that actually cause other problems where your body can kind of attack itself at sometimes.
So we know obviously diet will have something to do with it. I'm assuming the bed you sleep on. Look, let's face it.
Mm-hmm.
I mean, the bed market and the mattress market has taken off as far as get your number and get the right sleep night. I would assume that you are in line with that, saying, hey, how you sleep has a lot to do with how you feel in the morning.
One of the interesting things that I saw a research study the other day, and I can't quote exactly where it came from, but one of the biggest things that we see that helps boost your immune system is the amount of sleep that you get at night.
Right.
Okay. Usually 6 to 8 hours is about right. Okay. If you get less than that, you're going to be more prone to disease and also, other types of, bugs and that type of thing. As far as beds are concerned, mattresses are concerned, everybody's a little bit different. I've had a sleep number bed for the last 20 years, and I push a lot of people that way.
Yeah.
And the reason for that is because you can actually control how firm it is. I've got some patients who swear by their, what are those foam mattresses? Tempur-Pedic,
yeah.
Those things. Or, some of somebody talked to who's got a purple mattress the other day. All right. So, there are all kinds of mattresses out there. Everybody's going to find something that works a little bit better for them. The biggest thing is making sure that, if you go to bed at night and you're feeling pretty good and you wake up in the morning and you feel like hell, it's generally your mattress.
Right.
And so it doesn't matter how old or how new it is. It's just you're probably not sleeping on the right mattress.
So you can't blame your spouse anymore. Is that what you're
well,
saying?
it depends.
Well, and pillow too, right? A pillow is very important. Find the right comfort and the right way to situate your head.
All of that stuff, as far as support, is actually very important. And so the biggest thing is actually making sure that you can actually sleep. Right. And actually, get a deep sleep, make sure you're rested when you wake up. And those are all important in making sure your body recovers at times.
Well, and two, in the times we live in, obviously with COVID, your immune system is going to fight this disease off as good as anything. So you want that immune system as strong as possible. And sleep has a lot to do with it, like you said.
It does. Also, from a supplementation standpoint, things like vitamin C, vitamin D, vitamin A, and zinc all actually play a huge role in that.
How is your, not to get too on topic here with COVID-19, how have you seen your business change, that model, in the last 6 months? What have you seen as people coming in? Is there a difference? Do you see more people now? Do you see what has changed in this COVID world?
One of the interesting things about the whole COVID deal was that, first of all, everybody was scared to death when it all came out, when it all started. Okay, nobody knew what to expect, and I suppose I was probably in that camp as well. The interesting thing about this, though, was that, being a chiropractor, my office was considered an essential business. And the reason we were essential is because we help people get out of pain without having to go to the emergency room and without having to go to their medical doctor. So in a sense, we can actually keep people away from those places where people are sick.
Yeah, contain them away from the disease, sure.
So we saw a whole different set of not quality is not the right different group of patients than we'd seen in the past, and these are people who had, especially younger people, who are like, you know what, I don't feel good. I'm not going to my doctor.
Right.
I just need some help.
Yeah.
But along with that, we also saw a lot of patients who have been in chronic pain for a long time. They were scheduled for surgeries. They couldn't have their surgeries. And so they came to see us because it's like, we don't know when this is going to be done.
Sure.
And we don't know when we're going to be able to get in for surgery. So we helped a lot of people avoid surgery that way. The amazing thing that I've seen about this whole thing is that, everybody seems to be working together.
Yeah.
And I think that it just shows how important all the different groups are.
So we've talked about sleep and diet. Obviously, everybody's posture is bad. People's got bad posture everywhere. So, you probably are most sensitive when you're out at a restaurant or walking around. It's like, boy, look at the way that guy walks. Look at the way that guy sits, or that
you
or
have
that
no
gal.
idea.
So your sight is highly attuned to that. What advice can you give people just to start doing so you feel so you're just sitting and standing right?
First of all, and I talked to somebody the other day about this. One of the things that we have to deal with, especially with people, there's still a lot of people who are working at home.
Right.
And, a lot of these people who are working at home, they're using their laptop and they're sitting on their couch and they're crouched over the thing.
Sure.
By the time they get done, I'm seeing all these people who have all kinds of chronic pain. We got kids who are running around with their cell phones and they're looking down at their cell phones all day long, which causes a lot more stress and strain on the back of their neck. I think the biggest thing that we need to do is, first of all, make sure that we're actually aware of our posture and make sure that if wherever we are, whether we're at home or whether we're in the office, that we've got something that's ergonomically correct. And that basically just means that your desk height is the right height, your seat height is the right height, that your monitor is in a place where you don't have to look up or look down, you can look straight at it. Your keyboard is at the right height, so you don't have to actually strain for that, because a lot of times we'll see patients that do have things like carpal tunnel and other maladies that come along with that just because of their posture. Obviously, walking is important, but at the same time, doing some exercises to strengthen the back side of your spine as opposed to the front side of your spine. You go to the gym, and a lot of times you see all these guys that they're doing bench press, and they're working the butt, and they're doing curls and all this other stuff. They're working on everything on the front side of their spine, but they're not working the back side of their spine. Sure. And the back side of their spine is actually what holds them up straight. And so, a lot of the exercises that I have patients do, they're not necessarily things that you can do in the gym. They're actually just isometric exercises where you work to straighten your spine out, tighten up the muscles on the back side of your spine all the way down your back into your cheeks, into the back of your thighs, which actually helps strengthen those muscles. And those are the muscles that really help keep you standing straight up.
So when somebody's sitting a certain way for a long time, undeniably, whenever I move, something cracks. Something cracks. I don't know what it is.
It's because you're 50.
That's probably a lot to do with it. But I would imagine I'm not alone there. Something not to get alarmed about, right? That if you're doing things in a certain position for a certain amount of time, when you move, something will click or pop.
Well, what happens is the joints in your spine, they're very dependent on the movement of that you're doing, whatever. So we're not technically designed to just sit in a chair all day long. Right. Okay, so that movement's very important. The movement that we actually make actually helps with blood supply, and that blood supply is so we often think of our heart as being the thing that controls all the blood supply in our body. But actually, muscle contraction does as well, okay? And so when you sit for periods of time, it actually limits the blood supply, not only to the spine, but to some of the areas, in some cases, the rest of your body. It's the reason that you may notice that your ankles may swell if you're sitting for too long.
Yeah.
Because that blood isn't being pumped back up to your heart, being and pumped out in the lungs and everything else. So that movement is very important, but at the same time, the joints in your spine, they can actually dry out a little bit, or they can actually become a little bit more stiff. And as that happens, it causes more stress at the adjacent levels, the ones just above and just below. And so when you move, sometimes that'll cause that little pop or click, which actually causes a little bit of nitric oxide to be released in the area. And as a result of that, it helps relieve some pressure. That causes a relief in some of the stress in your nervous system. And that actually causes things to feel better for just a little bit.
So when your buddy comes over and says, and you fold your arms across, say, hey, crack my back, do you recommend something like that?
Not on a regular.
Pick them up and just crack. You don't know what I'm talking about.
Not on a regular basis. No. No. Generally speaking,
here's my grandfather's favorite thing when I was young. Hey, I'm gonna walk on my back.
Walk on my back, right?
Walk on my back. Do you do that over at the Busch Chiropractic?
I don't think I'm quite small enough to do that. In fact, we may really hurt somebody for that.
Yeah.
No, the thing about it is the reason that stuff feels good is because it actually does help restore some normal movement in the area. The problem is most of the time the joints that you're hearing move are the joints that are already moving more than they should.
Right.
So when we work with patients from a chiropractic standpoint, when we're adjusting or manipulating the spine, the joints that I'm generally moving are the ones that aren't moving as much as they should. And so as we work to restore normal movement, that helps to take pressure and stress off the adjacent levels, which actually helps with a lot of the discomfort. The interesting thing, and a lot of people don't really understand this when it comes to chiropractic, and I like to make sure that they do, is when we're adjusting or manipulating the spine, whatever you want to call it, cracking the back, whatever,
Right.
I hate that expression, but
yeah.
that's what
Don't take it literal.
everybody
Right.
understands.
Yeah.
I don't like to break things.
Yeah.
But no, when you do that, it's doing a bunch of things. Number one, it's increasing the range of motion in that particular part of your spine. It's taking stress off the adjacent levels, the levels above and below.
Right.
It's causing the muscles to reflexively relax. So all those muscles in the area start to relax. Okay.
So your breathing becomes better then too.
Breathing
right?
becomes
Yeah.
better, which is important. We'll talk about in a second. And then along with that, it also stimulates your entire nervous system. So, I don't know. You got a computer over here. I'm assuming every once in a while you have problems with it. You have to shut the whole thing down, reboot it, and bring it back up.
Mm-hmm.
When we adjust your spine, that's causing what's called an afferent barrage. It's sending a lot of information through your nervous system. And it's almost like you're resetting your computer or rebooting it. And as that happens, it helps reconnect your brain with that part of your body. And so it can actually help things function better.
Right.
Now, you mentioned breathing, which is something that's really important. And when we talk about breathing, especially right now with everybody running around with the masks on and everything else, the problem is we all are breathing way up here in the upper part of your chest, okay? If you watch everybody, when you get stressed, you start to breathe up here, okay?
Mm-hmm.
So everybody's breathing very shallow, okay? They do that anyway because we're all stressed because everything we watch on the news and everything we hear on the news. So as a result of that, we're not breathing off all the carbon dioxide that we need to. We do the same thing when we're wearing the masks. And as a result of that, if we're not breathing off enough carbon dioxide, we're not breathing in enough oxygen. And so you've heard of hyperventilation in the past, right? Mm-hmm. There's something that's called chronic hyperventilation syndrome. And what that means is over a period of time, you've got so much carbon dioxide in your system that you can't get enough oxygen in there for things to function properly. Okay. And we see a bunch of things go on with that.
Yeah.
We see elevated heart rate. Okay. We see elevated blood pressure. So they go up. These are things that everybody's taking medications for anyway, right? Increased stress. Along with that chronic pain.
Yeah.
Okay. And so what happens is that chronic pain that we start to see patients with, it just doesn't go away. And along with that snoring, which is the reason your wife wants to put a pillow over your head every day. But so these are all.
I'm divorced, but that had nothing to do with my snoring. I will say that.
All right. Sorry about that.
Maybe it did.
I didn't mean to get that close. But no, those are all things that everybody is seeking treatment for in some way, shape, or form.
Sure.
And so the thing that comes along with this is just actually practicing and even doing proper breathing exercises. The easiest thing you can do is put one hand on your chest, one hand on your belly, and breathe in without moving the hand on your chest. Breathe into a count of 7, and take a count in between, and then breathe all the way out, just moving the hand on your belly again. Wow. Do that 7 or 8 times. Don't do it more than that to begin with, because you will get dizzy as you start to breathe in more oxygen. But that's something that, as we start to try to relax, I have to do it every night before I go to bed. I don't know if you can tell I'm high strung. A little bit.
But it's not from coffee
it's
either.
Not.
So.
Well, I haven't had any yet. I thought about it. But no, but the thing about this is something that everybody's experiencing and everybody's walking around with, especially you got the masks on, you're actually doing the same thing anyway.
Right.
Even if you are breathing correctly. So it's something that everybody needs to make sure that they're doing at night. And just make sure you're not doing too much to begin with, because you will get dizzy after you do that for a little while.
And we don't want to give away too many secrets from the book, surgery not included, but a lot of great stuff here. And we mentioned and Amazon.com. I'm assuming that's the best place to get it. Dr. Richard E. Busch III. We talked about the times we're living in and the amount of stress that we have, and we talked about the causes of back pain and neck pain. Boy, the stress we're taking in right now. Is hard to believe at times.
Oh, it's unbelievable.
It almost feels to me is to take a step away, and you said breathe, fix your posture, do the right things, and come see you to get that oil check that you were talking about and the body alignment. Now, let me ask you this: why is there still a fear to come see someone like you? Because I know people are reluctant. You know what? I'll go get a back rub. I'll take a leave. Why is there still that? I don't know. Is it the word just getting your back cracked, or people just have that stigma in their head?
That could be part of it. Some of it is YouTube.
Right.
Okay.
But
Dr. Google scares the hell out of all of us.
Right.
But the thing about it is, I think that was a lot more prevalent back in the 70s, 80s, and 90s.
Sure.
We do work very, very openly with a lot of the medical community around here. Don't get me wrong, I get a massage as well. Sure. I don't get as many as I should. I think
does that hide the problem?
I don't think it hides the problem. I think it actually is very therapeutic.
Okay,
I think it helps.
Good.
There are a lot of things you can do that'll help. Exercise helps.
Yep.
Okay. Just plain walking helps. Physical movement in general helps. So, all of those things do help. At the same time, if we do have a problem with the way that your nervous system is functioning, and everybody does from a stress standpoint, if you think about when you get stressed, okay? A lot of people notice that their upper back starts to tighten up, their neck starts to tighten up. They probably get headaches. They may have some digestive disturbances. Those are all physical manifestations of stress, okay? And everybody physicalizes their emotions in a different way. So what that means is no matter what kind of stress you have, you're going to see it somewhere in your body, okay? Now, in some cases, things like massage will help. In other cases, if those joints in your spine aren't moving properly, it's going to cause a whole other problem. And so as a result of that, we need to do something to help make sure that we relieve that pressure. There are a lot of different ways to treat a spine. And what the book is about is mostly about the patients that don't respond to this stuff, where we need to do something a little bit more, where they're actually more along the lines of surgery. But when we talk about this, there are a lot of different ways that patients can receive adjustments or manipulations or anything else. We can use an instrument that just taps on your spine a little bit.
Right. And
they're very comfortable. And in fact, in most cases, first of all, they don't hurt. They feel pretty good, and after you're all done, you can also move better, and it helps stimulate your nervous system.
So the phrase "spinal tap" should not send the
Spinal
fear
Tap
of God.
was a great movie, wasn't it?
Yes, it was.
It was a great movie, but no, this is a whole different situation than that, though. And so when we talk about from just a straight chiropractic standpoint, there are a lot of different ways from a treatment for treatment to be rendered. The way that I do things is different than a lot of other people, and there are other techniques or different types of treatment programs out there. There are some from a chiropractic standpoint that may be a little bit rougher than others.
Yeah.
Those are, I think, the people that kind of have scared people in the past. But I've been in practice for 25 years now, and the neat thing about it is I see patients. A lot of the patients that I see have never seen chiropractors before, or they're really afraid of chiropractors because of that.
Is there obviously there's probably a too young to see you, and is there a too old to see you? Like when should be the first visit? When should be the last visit? Tell me
just to let you know, interesting side note. My both my kids we treated when they were a couple of minutes old.
Okay. So this whole your body's not fully developed. Your spine.
Well, if you think about it from the standpoint of the trauma that takes place during birth, especially in the upper part of the neck, it can cause all types of different things. And in fact, there may be problems with breathing or asthma and everything else that can be associated with what's going on in your spine. As far as elderly patients, the oldest patient that I've treated to date is about 106. She was funnier than heck. She was great. I used to see her every month. She passed away a little bit ago. Every time I saw her, she wanted three things really. She wanted an adjustment.
Right.
She wanted a hug, and she wanted to tell me a dirty joke, which was fantastic. I love the jokes, but they actually made me blush a little bit every once in a while.
And you do a sciatica pain a lot too.
Sciatica, yeah. Actually, a lot of the patients that we treat, and really when we talk about surgery, not included about the book, this is more along the lines of patients that they've seen 1 to 5 chiropractors. They've had epidural injections. They've had physical therapy, and they may have had 1 to 14 surgeries. Okay, and even some of those patients have had spinal fusions, and so sciatic pain comes as a result of pressure on the nerves in the lower part of your back, and that puts pressure on those nerves that go down. Sometimes it'll go down the front of your thighs, but most of the time it goes down the back of your legs. Can go all the way just in the back of your thighs or all the way down to your feet. And a lot of times we may notice numbness or tingling along with that as well. And so the thing about that is, movement becomes pretty compromised in those situations, and it causes a lot of pain. Those are the patients that we actually treat with the whole DRS protocol, and that's what we talk about a lot. DRS stands for decompression, reduction, and stabilization, and that's what we're actually doing with those patients. So we're helping decompress a nerve or take pressure off of it. We're reducing a disc bulge, and then we're stabilizing the whole thing so the problem doesn't return.
And most importantly, a good back, your golf game is going to be a heck of a lot better, correct?
Well, I'm usually good for a couple of strokes, but
you can't stop blaming it on your back, right?
No, well, the interesting thing when it comes to patients, I do usually have you stop the first the first week or two. We don't play golf for the first week or two.
Okay.
The only reason for that is because that stress that you put on your spine when you're swinging the club. But at the same time, what we also see, and it's not because I do a great job with what I'm doing, although I do, but it's because I have patients slow down their swing, and so they're usually a little bit better after we're done treating them because they start to not swing as hard and slow down their swing a little bit.
Dr. Richard Busch, a couple more minutes here. Surgery not included. But tell me the one thing you could tell our listeners. You'd be surprised. You're doing this every day, and this is not helping your back or neck. Something we haven't covered here, whether it be how you sit when you drive. Is there something that we haven't talked about that people are doing it every day and you're like, this is probably why your back hurts?
Well, one of the biggest problems I see with patients that have back problems or back pain is that they don't tend to listen to their body. Okay, when you start to feel that soreness, when you start to feel that pain, and then you keep going no matter what, that's usually the time that you should probably at least slow down, stretch, and do something else. But most of the people that have back problems for a reason. They don't listen to those things.
Right.
Now, sometimes it may be a result of some type of an injury or something like that. And, I got plenty of stubborn patients too. Where it's like, hey, this is who I am, this is what I am, and this is what I'm going to do.
Well, you're no different than any doctor. They're going to see you in the last resort. I don't want to go in there unless I really have to.
Exactly. And so the whole thing about this is, I think probably the best thing that I can tell you with this is it's kind of amazing to see the changes that we see in patients as they get better. Because what happens is especially if they've had all those things that we talked about before, the injections and surgeries and all that other stuff, and they've just been living with chronic pain. As we start to help them get better and regain their life, we start to see a bunch of things. First of all, we start to see the relationships with their friends and family change. So all of a sudden, instead of that person that's kind of a real pain in the rear end, in the office all the time,
literally, yes.
all of a sudden they start to get a little bit nicer.
Yes,
they start to become nicer with their friends and family, and and I joke with patients, spouses a lot that I'm going to make their husband nicer when we're done. So the interesting thing about this is, I guess probably the best thing to say is you don't have to live with the pain.
Right.
Okay.
That goes back to how we started this. Yeah.
Exactly.
Yeah.
You don't have to live with it, and there is an answer out there. And for many of the patients that we see, or many people that are out there that may have thought that they've tried everything or they've had failed back surgeries and everything else, those are the patients that we help. That's what I've dedicated my life to helping those people avoid that needless and unnecessary pain for the rest of their life.
It's BuschChiropractic.com. That's with a C. Go to Busch Chiropractic over there on Riviera Drive. So I just get a cortisone shot. I mean, that should straighten everything out, right? That's not going to hide any pain, right? The real problem.
It's not going to hide anything?
No. Well, I say that because people just try the shortcuts, and instead of getting to the root of the problem.
The thing about this is, and we see this with patients that say, you know what, if I just go and get that surgery, I'm going to be all better.
Right.
And, the problem with that is, and again, this is, when it comes to surgery, everybody thinks that it's going to be the best, the latest, greatest, and best thing for them. The problem is, in a lot of cases, it's just the beginning. They call it back surgery for a reason. Because you're going to be back for another one.
Yeah.
And that's not my quote. That's actually a quote from an orthopedic surgeon out on the West Coast. And the thing here is that if you can avoid that surgery, if you can avoid the medications and everything else, all medications have side effects. Again, they're generally worse than what you're taking it for. The injections, they actually, the way that they work, especially steroids, when they inject that steroid in there, it helps pull the bad fluid out of there to help take pressure off the nerve, right? Sometimes it makes you feel great, too, because they're steroids.
Yeah.
All right? Which is fantastic.
Yeah.
But then the problem is that steroid doesn't know the difference between the good fluid in there and the bad fluid. So it also pulls a lot of the good fluid out of the rest of the tissue, whether it's cartilage, tendon, ligament, and it actually dries that stuff out, makes it more brittle and more prone to new injuries. And this is the reason that we see patients a lot of times when they get injections in their knees over time, or injection in their heel or something like that. All of a sudden we start to see tears in other things like the Achilles tendon or some of the other parts of their spine or their knees and that type of thing. We start to see more damage because the soft tissue in the area becomes more brittle.
Well, and most importantly, and you said it earlier there, is the opioid addiction and the addiction to painkillers and all that stuff. We want obviously to steer people away from that, and this is a healthier way to do things.
Mm-hmm.
Dr. Richard E. Busch III runs Busch Chiropractic. Will there be a Dr. Richard E. Busch IV running this project? This great.
It's a long way off, man. It's a long way off. I don't know.
Well, I really appreciate you taking the time and hanging out with us. It's a fascinating book, and there's a lot we didn't get to. So pick it up. Surgery Not Included. And is there a consultation when they see you first, or they walk in the door, their back's going to get aligned that same day?
No. What's going to happen is probably the easiest thing to do is have them call the office, 471-4090, 260-471-4090. Schedule an appointment. We need to make sure that we have time scheduled so that we can actually do a proper history. One of the things that we find is if we do a great history, we have about 80% of what's going on.
Right.
But then after we do the proper history, we have to do a good physical exam. And this is a physical exam that involves both chiropractic, orthopedic, and neurologic evaluation. In some cases, we may or may not shoot films depending on whether we need them or whether the patient's already got them. If I need to, I can send patients out for MRIs. After I've had a chance to study everything, then we sit down with the patient, talk to them about what the problem is and what we need to do to help them. So basically, we go over a treatment plan with them so that they know exactly what we need to do, how often we'll see them, over what period of time, expected outcome, all of that stuff. We go over that really before we begin care, and the reason I do that is because I want to make sure that they know what the plan is.
Right.
I find that we have a lot better outcomes if people understand what they're doing and why they're doing it for, or why they're doing it for, why they're doing it.
Why they're doing it, yeah.
Sorry about
the $1 million question is the wallet and how it affects the wallet.
Mm-hmm.
Most insurance plans and you coincide?
In some cases, insurance covers some. In other cases, it doesn't cover any. But that's something that we go over before we do anything.
Right.
So the whole purpose of my doing the exam, history, and everything else is we want to make sure we know exactly what's going on.
And you know what it'll cost you if we want to
before we begin any real care. We'll sit down and go over everything.
I'm assuming my HSA account would.
HSAs, yes, HSAs work very well with what we do.
Right.
And so again, the whole purpose behind this, the world is changing. It's not the same situation that it used to be as far as, especially with insurance. The last 10 years we've had a hell of a ride with that.
Yeah.
So, the interesting thing with this is basically the way that we go over all this stuff, we want to make sure that people know exactly what we're doing and why before we begin anything. And so that's the reason I handle the explanations the way that I do, so that people really understand what we're doing and why we're doing it.
To me, you go to the dentist a couple times a year. You go to the eye doctor a couple times a year. Wouldn't it make sense to make sure your spine and neck are doing well too?
Exactly.
All right. Well, Dr. Busch, thank you so much for spending time with us. Again, it's surgery not included. Go to buschchiropractic.com. That's Busch with a C, by the way. And, of course, you can go visit them, Riviera Drive. Call 471-4090. That's 260-471-4090. I hope to see you soon. Just be gentle. That's all
I
I'll
appreciate it. You're welcome anytime.
This has been a presentation of podcasts by Federated Media. Subscribe now and rate and review the show. Stay tuned for another episode of Rags in a Box, only from Whoa Whoa.